So in order to identify key factors, the answer is to take a sex status. Now, a sex status is not a questionnaire or a test. It's a flexible, focused history-taking method to uncover the key psychosexual, behavioral, and cultural factors. A good sex status is going to create a video picture in your mind about the friction, the frequency, fantasy, and feelings the patient is experiencing by identifying the factors that precipitate and maintain the distressing sexual disorder. Now, how do you do that? Ask focused questions, step back, and then probe again, depending on the patient's comfort with the inquiry. So you know from your own clinical work, some people come in and you almost have to, stop them, interrupt their speaking so you can capture the information you need, which of course you want to do while maintaining rapport. So there's this constant back and forth balance between getting the information you need to evaluate with maintaining rapport during that initial interview. Depending on your own time, the patient's responses and comfort level, as well as your own comfort level, you want to probe for the needed details and sexual experiences that illuminate the key factors. So you want to ask specific questions, you'll listen, and then you're going to clarify. What do you mean by delayed ejaculation? Tell me what you mean by premature ejaculation if they're labeling themselves. Tell me what you mean by erectile dysfunction. Tell me what you mean by you have no desire. Help me understand that better. What do you mean by that? Tell me about the pain. Where's the location? Where are you feeling it? What's the intensity? How would you rate it on a 1 to 10 scale, etc.? These various chief complaints. And then I always ask patients, what do you think is causing this problem? People often have a very good understanding themselves of what's going on. Sometimes they don't. Sometimes they overthink it. Sometimes they're not insightful enough. But often they've got a pretty good idea and you want to find out what they're thinking. Now, this is, of course, going to vary with new patients coming to see you for a sexual problem, as opposed to established patients who you may be seeing for other reasons who've been in your practice for years. Now, for me, one of the best single probes you can ask is, quote, tell me about your last sexual experience. I ask almost everyone who comes to me for a sex therapy issue that question. It gives me a video picture in my mind that helps me identify both immediate and remote causes. Let's talk about how. What are the critical evaluation issues? So what do you want to obtain when you get answers to these questions? Number one, does the patient have a sexual disorder? And of course, what's the diagnosis if you can make one? This is particularly important because sex is sexy. So quite often you'll have people seeking your assistance for therapy, presenting a sexual problem as a way of getting in the door and capturing your attention in the hope that you will accept them as a patient. So you really want to clarify, is there a sexual disorder or something else going on? Second, and of course I appreciate that for many physicians, it's more of the doorknob kind of situation. As the patient's leaving, having spoken to the cardiologist, oh, by the way, doc, I'm having a little trouble getting, what can you do about that? And the consultation is almost over, the person's at the door. By the way, if that happens, what you want to do is just reassure the person that there is help available, but it's a little complicated, and we want to make another appointment to discuss this so that I can really provide the thorough attention to this issue that you deserve. That way you can still stay on schedule for those of you who have sort of tighter, more limited consultation time available to you. The patient is reassured that they're going to be able to get some help, and you can escort them back to the waiting room. Second, what are the key underlying biomedical, psychosocial, and cultural factors that are at play in this situation? The most important to capture initially is what are the immediate maintaining factors? What are the current cognitions, emotions, behaviors, organic, medical, etc., causing on an immediate level to maintain the problem? And then second, you want to get a sense, at least an initial sense, of any deeper mental or physical causes that are emerging, whether they're predisposing or precipitating. And then third, do any of the underlying factors require pre-treatment, or can they be bypassed, modified, or treated concurrently with the sex therapy? So for instance, evaluating the person's level of depression, the degree of marital conflict, whether or not they're addicted to some drug, alcohol, etc.